Once again, you are watching Sunrise at Sea, and if you just joined us, you are right in time for the Twitter Jabs Part 2. I am your host, Sandra Cope. Now, this morning I have a very, very important gentleman with me in the studio. His name is Dr. Charles Olaro, and he's the Director of Clinical Services, Ministry of Health, Uganda. Now, Dr. Olaro holds a medical degree and a master's degree in surgery from the Makerere University, and he also holds a master's degree in health services management and business administration management from the University of Isami. His career entails being the director of the Fort Portal Regional Referral Hospital from 2010 to 2017, and before that he was the medical superintendent of the same hospital from 2007 to 2010. The good doctor here holds a lot of wealth in the diagnostics, readiness and preparedness of infectious diseases such as HIV, Ebola and COVID-19. Good morning, doctor. How are you?
Morning.
It is such an honor to have you in the studio this morning.
Okay.
Thank you for gracing us with your presence.
You're welcome.
Now, I'd like to dive right into it. It is about 11% of our population that is double vaxxed at this time. Is it?
Not 11%, because definitely we have gone close to 20, more than 20%.
Okay.
Who have got a single dose. So
for the double vaccinations?
Double vaccinations, yes, we should be about that now.
11%?
Yes, please.
Yes. And with that, do you think that it is safe for people to start traveling up country and start congregating during this festive season? I mean, because we even have a new variant now in the country. What would you advise them to do during this festive season?
First of all, what we need to know is that COVID is with us, and you will not go on a holiday. And it is worse even as now we get toward this festive period, we're having a new variant. People definitely are tired. They would want to get together with the families, have celebrations. But I must say that this is coming at a very wrong time.
Yes, absolutely.
WHO Director General has actually advised that we postpone celebrations.
Yeah.
That it does not make good sense. It's better that we cancel celebrations than to cancel life.
Yeah.
Or we postpone celebrations, we celebrate later, or than for us to celebrate now and grieve later.
That is correct.
So those are the key issues. So coming back to our Ugandan situation, in the last 4 days we are recording over 200 cases positivity, with a positivity of about 4%.
Yeah.
You remember we had gone to almost 0.5.
Yes.
But we are having now 4%. With Omicron, the doubling time is between 1.5 days to about 3 days, which means that if you have one case today, in the next, the numbers will do what?
You could reach to community infections in no time.
Will double.
Yeah.
So that means that this Christmas or festive season is just being like a wildfire, as the president used that you are setting up a wildfire.
So do you think it is safe for people to be traveling cross district borders at this time? I know it is our tradition, but like you said, it's better we postpone these festivities now, celebrate later than to celebrate now and grieve later.
Yes, definitely people want to celebrate, but you can still be able to celebrate. But it would be advised that we postpone one. It will look very weird, but it's a fact, because it's coming now that we're actually getting to the third wave.
Yes, it's
we're getting actually imminent that we're getting to the third wave, and the 10 days between now and the end of the year will be really determinant of what picture we are going to see in the next, as we plan towards opening the country for economics, for schools. So it will be good that we exercise some restraint. We consciously celebrate, get ourselves vaccinated, those who are vaccinated. If you have not been vaccinated, this will be the time for you to get vaccinated.
Yes.
If you've not been putting on a mask, actually, this is the time you should put on a mask consistently. Just
Yes.
like when we had HIV, we were advised about condoms. You should actually
Yes.
put on a mask consistently. If you have to celebrate, do it outdoors than to do it indoors. And then we also be that wash hands, social distance. So it's not just a single intervention. It's going to be a combination of interventions
To combat.
to combat it.
Yeah.
Definitely, as a minister, as the health sector, everybody is tired. The system, we do not want the system to get what? Overwhelmed with the number of cases.
True.
Yes, we have heard that people have talked of that Omicron is mild, but still people who have got vaccinated, those who have got infection, are still going to get what? Infection,
Yes.
are going to still get sick.
Yes.
So we would really not, it's too early for us really to say that Omicron is what? Is a mild infection.
Okay, I'm thinking that if you look at countries like Denmark and the UK, with getting the Omicron variant, what their strategy has been to vaccinate themselves out of this crisis. Yeah, and I know that there have been some ongoing vaccination campaigns countrywide, but do you think we should use that strategy to accelerate vaccinations in the country, adapting to what the US is doing by including military medical personnel, so that there is more manpower and more outreach and people can get vaccinated on a faster rate?
I think an approach which use, recently we had partnered with the Rotary, and again I think in early January we're going to do one. So we want everybody definitely to get involved. But at the same time, we are seeing in that a majority of young people are getting vaccinated, are coming to get vaccinated. But we are not seeing the elderly. And yet these are the vulnerable groups.
Yes.
So we really would want that, we want to urge the population, let's get this elderly, the over 50s, to come and get vaccinated.
But do you think this is because this pattern, it has been there, like the elderly people don't want to come out and get vaccinated? Yes, yet they are the vulnerable ones. But most of them are saying that they have these myths surrounding the vaccine, that it is not safe for them. And people of such age groups also have pre-existing conditions like diabetes, yes, and other issues, blood pressure and everything. Do you think there is need for more sensitization to make them comfortable and warm up to coming out and being vaccinated?
We shall continue to preach all these information. If you look now, over 10 million jabs given, and we will not had the greatest severity or side effects from it.
Yes.
So, and if you look at globally, how many doses of vaccines have we got? Africa alone has only been able to administer 8.4%. That's the population they have been able.
Yes, yeah.
Other countries, they have been able to vaccinate over 70% of what? So if other countries are vaccinated, so how are we now, Ugandans, saying that we should not get ourselves vaccinated? The vaccine is only one of those tools which can be able to protect us.
Okay, and let's move on to the medical interns that recently went on strike. And one of their concerns was they didn't have PPEs, personal protective equipment. Was this issue addressed? Because they're on the front line. I mean, and we have new cases coming up, so the hospitals are going to get busy. This medical personnel really need to be protected. It's another avenue for also protecting ourselves during this festive season.
Okay, I must first say that when the pandemic started, definitely there were global shortages of whatever, what you needed. But the government put in all the efforts to be able to do it. And we've had a great improvement until even when we have had factories within the country which are able to manufacture some of these PPEs. I must also hasten to mention in here that we've not lost any employee working in the CTUs, which means that actual government provided the what?
Yes.
The PPEs. PPEs are single-use materials.
Yes.
Single-use materials. So definitely you need large quantities of them. And as government, we are committed to continue to do one, to provide PPEs, because one of our key priorities is the safety of our health workers. Health safety and patient safety.
Absolutely, absolutely. Now, I would like to ask you, Doctor, with the kits that were donated with from the World Health Organization, the test kits, yeah, for COVID-19, 3,306 kits were given to us, yeah? Will these kits come into play as people go to rural areas because there are no laboratories there are no medical experts, there is no electricity, that's why we came around with these kits. Will they come into play? Should they come into play during this time, just to monitor the infections during these festive seasons as people are in their villages?
First of all, diagnosis of COVID has greatly improved. When we started in, we only had the real-time PCR.
Yes.
We had the WHO approved the rapid diagnostic tests,
Yes.
which have been rolled to up to health center phase. So the donation specifically which came from WHO of recent is to help us to be able to differentiate Omicron from the Delta 1 variant.
Yes.
So what happened that if you subject that to that and probably it is not Delta, then probably you think that this is an Omicron what? Variant.
Yes.
So it is for generally to be used centrally than for it to be used peripherally. So the other kits, the rapid diagnostic test kits which are at health center freeze will still be available.
Okay.
But what is important is really for us to be able to prevent. Put on mask, sanitize, avoid congested places. Because you already had the scenario which is all around the media of what has happened to our legislative house. Yes. So those are things which definitely will that anything which you do not follow will definitely lead to a multiplier what? Effect. A multiplier effect.
Okay. Well, you had that from the good doctor this morning, Dr. Charles Olaro, and he's the Director of Clinical Services, Ministry of Health, Uganda, well versed in infectious diseases. So please listen to the good doctor this festive season. Wear your mask, sanitize, social distance, do everything that you can to stay safe during this festive season. Well, before we go, Doctor, how are you going to celebrate your Christmas?
I definitely was one of those because, first of all, for the last 2 years, we've not been able to have celebrations.
Yes. Yeah.
We definitely would have wanted to join family, but now it's with a lot of restraint.
Yes.
That if you have to take personal responsibility to protect yourself, your family, and the people around you. So it's still, the celebrations are probably going to be low keynote. It's not really going to be.
Yeah. Oh, okay. Will any medical workers also be taking Christmas? Will they be taking like shifts to celebrate with their families and loved ones?
The ministry did recruit additional surge staffs. So we've had surge staffs, and if the numbers continue to be low, and probably if they are still being mild cases managed at home, we think really that despite the COVID, the health workers should have some rest time.
Yes, they should actually, because also working 24 hours round the clock is also not safe and advisable. Well, Doctor, I wish you a Merry Christmas, and everybody from the Ministry of Health a very Merry Christmas from me and the team here at CTV. Thank you for coming in this morning, taking time and gracing us with your presence. We really appreciate it.
Thank you.
Well, that was all we had for you on the Twitter Jabs Part 2 this morning, and please stay safe. You're traveling with families and everything, but keep in mind that we are still trying to navigate a pandemic. Well, I'll still be back showing you how to shop for kids this festive season. I mean, they're such a huge part of Christmas. It is the birth of our Lord Jesus Christ anyways now, isn't it? Well, don't blink. We'll be right back.